Hello, everyone. This is Dr. Jerry Cuomo. I'm here in my Boca Raton office. Um, and our treatment plan today is going to be tooth numbers 20 and 21. We're going to go ahead and start with the rubber dam. I'm going to go ahead and punch my holes on the left side of the rubber dam. And I usually like to punch a large one and then another one just in front of it, and we can now stretch the rubber dam. Maybe we'll go one more, and we'll stretch the rubber dam from her first molar all the way to canine tooth. So by troughing it, we can stretch that. We're going to use our clamp today. Is going to be a 212 winged molar clamp. We're going to go ahead and insert that first. All right. Great, and you can go ahead and open. And we're going to clamp our molar first, just ever so gently. That should do it. You okay? All right, saliva ejector, please. And we'll put the saliva ejector around on the patient's lower right. We're going to apply a little bit of lubrication to the rubber dam itself. I'll do that with a small amount. And just to the reverse side. So this is the tissue side or the tooth side. We put a little bit, not much, just enough. And now that should allow us to stretch the rubber dam in place. And well, let me just have that thing right there. Yeah. And we'll use this as our rubber dam napkin. We'll put that down first. That'll help keep her face nice and cool. And we slide the dam in place. All right, all the way back and around like so. Easy enough. Now we'll just stretch it all the way to our cuspid. And then my dental assistant's going to go ahead and ligate that with some dental floss. So we have something that's pretty easy, straightforward, and quick to put in place. We're going to start off with a 330, number 330 friction grip. I'm going to go ahead and remove the old amalgam. That's first on our list. You okay underneath, Sandy? Great. We'll start off with 5 magnification. And we're literally just painting around the area. We're going to just spray just a small, slow amount of water. And with our prep now, this is a class 2 amalgam restoration being removed. Everything okay, Sandy? Okay, great. And then we'll go back up to 20 power. As we're getting closer to the adjacent tooth, so we want to stay up on high magnification at this point. All right, looking good. Now we're going to switch gears. I'll grab a mirror and we'll take a look at the facial wall of our prep. And we notice there's our decay. Easy enough to see. So that's where we predicted it was going to be, and it's actually, it's there. So we're going to use a little vibration. I'm just going to remind my patient that you'll feel a little vibration because we're using a slower speed handpiece. And this is a number 4 round burr, number 4 round burr. And some water. So now cleaning the box area from decay. Alright. And now we'll have her dry. Go ahead and dry that. Alright, so we're just going to check. So now with just some light air on the tooth, I'm just feathering the surface and see if there's anything else that's going to be soft in the box area. If you look real closely, air on the mirror, you'll see a shiny surface, and that will tell me that I'm back on good quality dentin again. So in the box area, a little more air. Great. So now we still have a lot to clean up, but we got the bulk of the problem under control. We'll go right back to finishing all the areas that are involved, but certainly a lot of it's just polishing at this point. So on to the next step. We're going to switch gears now. I'm going to go to a fine diamond. So a straight fine diamond. And sometimes I'll come in here with a scaler. It's removing all the stain, dentin with the fine diamond. So we're, as far as drilling's concerned, we're pretty close. I'll try to always remind my patients I'm about 60%, 70% done with the drilling at this point. I'm just really polishing surfaces now. So the bulk of the drilling is over. So again, a DO on tooth number 20. Today's assignment. I went in there and cleared that contact. Now I'm going to come back and bevel. Anywhere the enamel is, I'm going to put a little bevel on that because I want to get a nice polished surface where the filling meets the enamel. That needs to be highly polishable. Otherwise, you end up with some staining over time. And we don't want that. A little water again. I'm going to need some water with this. All right, some water, please. Here's tooth number 21 now. Now we don't have to cross the oblique ridge. We can just do what we call the class 1 prep and just stay in the pits. Alright. Now I'm going to go back to my round burr. You okay underneath? Now this is at 3.5 power. You can see that we can almost see the entire arch at 3.5, where most of the time that's where loop starts, at 3.5 power in dental school. So, and some of the students are at maybe 2.5 power. So you can see with the microscope we're way up on a much higher level of magnification. You see a lot more and you get the job done a lot quicker. See, we're almost done. Probably right about 85% finished now, right? Air on the mirror. Okay, so you see there's a small amount right there. We'll get rid of that. I'll use a smaller burr and a little bit right down on that cavo margin right there. The gingival buccal, gingival line angle and the buccal wall. So again, let's see if we can handle that with our high speed. I have a little problem with water. Can we have a little water, please? Okay, air on the mirror. And we'll zoom in. Now we'll just have air only on the tooth. I'm gonna place a small amount of Siltrax packing cord, and retraction cord's important. And I'm gonna use a smaller round burr now. I'm gonna go to my half round, and we'll do a little more cleaning, a little more vibration here. Right there. So this is 21 is classified as a class 1 filling, class 1. And this is more of a class 2. Now we're going to use a scaler first, so I'm going to go to my scaler next. I use a Sickle Scaler. I just love that instrument. It's small enough to get into the tightest areas, and it's also easy to use. And we'll do that. A little water again. That looks good. And I really appreciate my patient letting me do this today to film, as she knows there's going to be a lot of eyes watching her tooth today. I better do a good job. All right. It's good to have a little dental sense of humor. We pull it from wherever we can pull it from. A little water again, and we'll dry it. I'll go right in there. This is Siltrax 7. And you can see it's braided. And one of the things I like about this packing cord, it's pliability, and it stays where you place it. Doesn't pop up like some other brands. Pascal is the name. I'll need an Explorer. And then we'll use a pair of scissors. We're just going to tuck this in ever so nicely. I like the long Explorer. It's got a hook on the end of it, and I just basically move that in place. Let's see if I can thread this end through. There it goes. Now I come up from underneath and just tuck that in. There we go. Now we can just leave that in like so. Don't need scissors. We'll rinse that next. I'm going to go ahead and use something called cavity cleanser. We'll back up on the magnification. Don't need the scissors. All right. So somebody asked me, what's in the syringe, Doc? Well, we use chlorhexidine gluconate from the company Ultradent, I believe. And it's also called Conceptus. So it has the best taste out of all. I've tried them. This one seems to go over pretty well, although it does not, taste great, but it's still a better. It passed a better taste test. It passed the taste test. That's right. All right. So now we're going to go ahead and etch our enamel and then our dentin. So we got to go around the perimeter first. Let me have another syringe. Okay. All right, here we go. So let's start in the base area, come all the way up the side. Go in the pits, cavo surface, here, and then inside here. Let's go 15 seconds from now, and then we'll go ahead and rinse for 15. I like to get in the habit of sealing everything. When I can see it, I can seal this tooth. And if you look real closely, you'll see some carbon dioxide bubbles starting to being produced by the chemical reaction with the tooth. So now the 15 seconds are up. We'll go ahead and rinse. All right, that looks good. We're right about 16 minutes into it. That's not bad from putting the rubber dam on, 16 minutes. I hope no one's fallen asleep out there. This is my chelator I like to use. It's called Tubulus Sid Red, and it does a nice job of disinfecting the tooth. And then we just suction off that, and I get a dry brush and go ahead. Now I'm going to paint my primer. I'm using Albond 3, I believe. Albond 3 from Bisco. Go ahead and suction off that coat. And I'm going to go one more coat, and then we'll hold any excess until I dry everything off thoroughly. Because you never know, I might need another coat, so hold that. We'll dry off everything thoroughly. We're going to look for a shiny surface, especially in dentin. That's pretty shiny, so we can go ahead and light cure that. And I just want to make sure nothing pooled. So ready for the light. And we'll cure that. I should go about 20 seconds on the cure. And switch to the next tooth. And right about 20 minutes into it. So I'm going to save some of this for the next segment. So this is Dr. Jerry Cuomo. I'm going to take a quick break. I'm going to put the filling in next, and we'll see you on the next segment. Take care.